Thank you very much, George. I first want to say that I come here as a representative of the American Pharmacists Association, which is actually just across the street, so the walk wasn't very far. But I am president of the American Pharmacists Association, and I want to say on behalf of the association, really a fantastic job on the report. Pharmacy is very supportive of nursing and their roles on the team, and personally, my wife has been a labor and delivery and postpartum nurse for over 20 years, so I have no choice but to be supportive because she does help with the income in the house, so that's very good. But one of the best values that I think nurses bring to the table is their focus on demonstrating caring for the patient in addition to providing care. One of my professors at the University of Minnesota was often fond of telling students there that patients don't care how much you know until they know how much you care. And if at the end of all this, if the healthcare team really isn't able to make the patient feel as if they're cared for, then we've really missed the mark. But the report did a great job of providing a concise and very precise description of the team-based care models that are out there. And as a pharmacist, I was definitely impressed that several of the team-based care models, and this to your point, Stuart, actually did have examples of pharmacist-led models, because we know that medication use is an integral part, an important part of the care that's provided to patients. And I'm not sure if you know this or not, but pharmacists kind of know a lot about medications and how to use them. We get quite a bit of education in that realm. And so it was really good to see it. And I don't know if this is the appropriate venue to make this comment, but isn't it time for an IOM report on the future of pharmacy? Because, when you talk about the changing dynamics and the changing environments, pharmacists, are probably one of the most overlooked members of the team when teams get put together because of the stereotypical views that many have related to just dispensing. But in fact, pharmacy practice has changed dramatically over the years. Pharmacists are practicing in a variety of settings, including what most people know as community pharmacies, but also hospitals, clinics, physician office practices, long-term care facilities, and as consultants. And pharmacists use a patient-centered care process to deliver a variety of patient care services, such as medication therapy management, which is focused on optimizing the use and ensuring patient safety related to medicines, as well as medication reconciliation in the hospitals and during care transitions, but also many prevention and wellness services such as health screenings, smoking cessations, and immunizations. In fact, all 50 states allow pharmacists to provide immunizations, which is a great success for pharmacy. But pharmacists also have been involved in chronic care management, and that's really our largest role, is in the chronic care, because chronic care patients are on medications for a long period of time, and because they have multiple chronic conditions, they're on multiple medications, which leads to more patient safety issues. And really, I think patient safety is the one linchpin for all members of the team, right? If everyone is focused on patient safety, avoiding adverse events, avoiding hospitalizations due to medications, improving health outcomes, that patient safety piece, really gives us a strong linkage to why we do what we do and why each member of the team is important. So I have a couple minutes left here, and I'll say that in addition, you may not know that pharmacists do have the ability to get engaged in collaborative practice agreements throughout the U.S. There's about 40 states that allow pharmacists to be involved in collaborative practice agreements with physicians being a part of the team. And we're seeing more and more pharmacists' involvement in different areas, specifically within the accountable care organizations, care transition organizations, and even the medical group models, where the pharmacist is embedded in that practice. And in fact, some of those models, there's one in Kingsport, Tennessee, that is so advanced that, they basically have the physician doing the diagnosing, which is definitely their forte. Pharmacists don't want to have any part in that. But once the patient with a chronic condition is diagnosed, some of the patients are turned over to the pharmacist for all the follow-up care, even initiating therapy, modifying therapy, discontinuing therapy. to great benefit to the patients, because we used a guideline approach, as was mentioned in the previous comments, with I was going to say quick med, but that's not it. That's the competition. It's Minute Clinic. So they provide great value. So at the end, I just want to say that, pharmacists are very supportive of nurses. I mean, pharmacists, especially in the hospital setting, work very closely with nurses, and the roles of nurse practitioner is phenomenal. I'm also prior military, so I had a lot of experience with dealing with nurse practitioners and physician assistants, because I was a pharmacy tech in the Air Force for about 6 years before I got out to go to pharmacy school and then go on to get my Ph.D. So I'm very encouraged by the report, and I'm very excited to see what will continue to happen and how nurses will continue to be able to progress within the team. And I do hope that we can get that future of pharmacy report done at some point. So thank you very much.
Thank you. Right on time. Perfect. Set a great example for everybody to follow. Rebecca?